BingX, a trusted global crypto exchange. Trade spot, futures, or copy top traders easily. Sign up via the link or referral code to get 30 USDT instantly, plus up to 1,500 USDT in bonuses for verification, deposit, and trading.
Anti-malaria funding cuts could lead to deadliest resurgence ever, study warns. A stark new analysis paints a grim picture for the global fight against malaria, warning that significant reductions in financial contributions from wealthy nations could unleash the most devastating resurgence of the disease in history. This potential rollback threatens to reverse decades of progress, costing millions of lives and billions of pounds by the end of the current decade. The report highlights that the battle against malaria is already facing unprecedented challenges. Extreme weather events, exacerbated by climate change, and escalating humanitarian crises are increasing the number of vulnerable populations exposed to the disease. Compounding these issues is the growing biological resistance to insecticides and the very drugs designed to combat malaria, rendering current control measures less effective. Gareth Jenkins of Malaria No More UK issued a direct warning, cutting funding risks the deadliest resurgence we've ever seen. The economic ramifications for sub-Saharan Africa, a region disproportionately affected by malaria, are predicted to be catastrophic. Leaders across the continent have urgently appealed to the G7 nations to maintain their investment commitments, emphasizing that a robust malaria control program is not merely a health imperative but a catalyst for economic growth and trade. They are also calling on the private sector and high-net-worth individuals to step in, recognizing the substantial economic potential that can be unlocked by effectively controlling this disease. Joy Fumafi, representing the African Leaders Malaria Alliance, or ALMA, which co-commissioned the crucial research with Malaria No More UK, underscored this sentiment. She stated, "African countries are stepping up to the plate, and we are appealing to the rest of the world to accompany us on this journey, because all of us need to be part of the end story of malaria." The analysis meticulously details the projected impact of funding shortfalls on the global fund to fight AIDS, TB, and malaria. This vital organization, which provides nearly 60% of all international financing for essential malaria control interventions like insecticide-treated bed nets and preventive medicines, is currently seeking donations to secure its operations from 2027 to 2029. The report's simulations reveal a stark reality. A mere 20% reduction in funding compared to the previous replenishment cycle could result in an additional 33 million malaria cases and over 82,000 deaths by 2030, accompanied by a staggering $5.14 billion in lost gross domestic product. Disturbingly, these funding cuts appear increasingly probable. Germany recently pledged $1 billion to the Global Fund, a commitment that falls 23% short of its previous contribution. Reports also indicate that the UK government is considering a reduction of approximately 20% from its prior pledge, though no final decision has been announced. The consequences of a significant funding vacuum could be truly devastating. If preventive malaria control programs were to collapse entirely, the report estimates an apocalyptic scenario, an additional 525 million cases, nearly a million more deaths, and a colossal $83 billion in lost GDP. Alarmingly, approximately 750,000 of these projected deaths would be among children under the age of 5, a chilling statistic that the report's authors warn represents the loss of a generation to malaria. This underscores the gravity of the situation, with charities already highlighting that proposed UK cuts to global aid could tragically lead to an estimated 300,000 preventable deaths. Conversely, the report presents a powerful counter-narrative, illustrating the immense benefits of sustained and increased investment. If the Global Fund were to receive its full requested $18 billion, the economic returns would be substantial, projecting a $230 billion boost to GDP, a remarkable reduction of 865 million malaria cases, and the prevention of 1.86 million deaths. Fumafi further elaborated on positive domestic trends, noting marked increases in domestic budget allocation not just to health, but specifically to malaria, particularly since the beginning of this year. However, she cautioned, "I think we need to appreciate the enormity of the challenge and exactly how much is required in funding in order for countries to be able to catch up." African nations, already grappling with the heavy burden of debt servicing and the lingering economic fallout from the COVID-19 pandemic, are facing a dual health crisis, contending not only with infectious diseases like malaria but also with a growing epidemic of non-communicable diseases such as diabetes and cancer. It is therefore particularly concerning, Fumafi noted, that donor countries are contemplating reduced pledges. Nevertheless, she expressed gratitude for commitments from nations like Germany, acknowledging that a $1 billion pledge, while a reduction, remains a substantial sum. The former Botswana health minister conveyed optimism that wealthy individuals, the private sector, and philanthropic foundations would rise to the occasion. She reasoned that when we talk about productivity, jobs, and the economic potential that Africa tends to lose, we are talking about potential investments in markets for the private sector. Reinforcing this perspective, Nigerian businessman Aliko Dangote urged his peers to join him in bridging the funding gap, articulating a powerful business case. Malaria is not just a health crisis. It is an $83 billion brake on Africa's growth and enterprise.